Hi everybody, welcome to our Ask the Exec session. It's nice to see you all. You'll note that we are not live from the Tony Foote room because we're all in our rooms individually. It's much easier to talk and convey communication not behind a mask, as I'm sure you're all becoming familiar with. So we're in our rooms, we're not breaching PPE, and looking forward to a good conversation. By way of introduction, we've got Anne-Maria, Director of Nursing at Alison Wyld, Interim Director of Finance, with us for the session today. Like I say, you're all very welcome. The usual rules apply with regard to questions. Put them in the chat, let us know, put your hand up, and we'll try and cover them off. If you're not talking, keep mute, etc. If we don't get the opportunity to get your question answered today, then we will attempt to get an answer done within the week. So without further, I'll just give us a sort of summary as to where things are. It's been a bit of a week, as I'm sure you're all aware, but the very, very, very good news is that we started vaccinating. Yesterday, the first COVID injections, I'm sure you will have all have seen on the national news, and we started in Nottinghamshire as well at the two hospitals based in Sherwood Forest, Kingsmill, and at Queen's Medical Centre in Nottingham. And it's brilliant. It's, as people have said, it's the start of getting on top of the pandemic. There are a number of really important constraints about this that I think it's important for our people and our senior leadership to know. The first is to say this is a really rapidly changing programme, and therefore ordinarily we'd like to plan ahead and give people lots of notice. It's just not going to be, we're not going to be able to be like that, unfortunately. So I think be prepared for urgent asks, changes of plan, different things, because there is, as you can tell, an awful amount of political pressure behind this. But this is a rapid mass deployment of something that's new, and the infrastructure that sits behind this is being developed as we go. So that's a sort of bear with warning. And just one example of that, we'd had plans set up nationally, but also within the Nottingham system for a certain plan of action for this week, which was changed mid-weekend. So you can imagine the sort of scurrying around behind the scenes to get things up and running. And so that's the first thing. The second constraint is the particular type of vaccine that we're using at the moment. So this is the Pfizer-BioNTech one. It's a tricky vaccine to handle. It's got some relatively unusual properties with regard to the deep cold temperatures, the fragility at transport, and you'll see on the news very soon, if not already, that it can tweak some quite sensitive allergic reactions, and there were a couple nationally overnight that came to light. So there'll be emergent advice about people that have allergies, and I won't second guess that, but there'll be some further guidance. Those constraints limit the distribution, so it's well suited for big hospitals that have got deep freezes and available staff and patients to jab. It's not suited to splitting up the cartons of 900 and sending them around the county. So the logistics of planning the priority cohorts of the over 80s, the care home residents, is fraught with challenge. The second thing about the vaccine is that we haven't got a planned itinerary of when we're going to be receiving the next delivery and how much we're getting. So again, there'll be some relative last minute comms coming around about what we've got where and where it's available. We are saying to all our staff that we will contact you about the availability of your vaccination as we go through that priority list, and that you don't need to be asking or seeking the vaccine from elsewhere. But as yet, that is all in the to be confirmed where and when. But we think it would be easier that once we've got a rolling list of prioritised staff, we will help you locate that vaccination when and where. At the moment, as I say, we've only just got 2 sites, but there is a programme of other sites opening out across the county over the next couple of weeks. And again, we're waiting the infrastructure, the pods to set them up. With staff and facility management, waste disposal, all that sort of stuff takes setting up. But there's an array of sites across the county that people will be able to access, and eventually through primary care networks and GPs too. So again, that's we'll let that come from those positions in due course. One of the things that will make a really big difference is as other vaccines get signed off by the regulatory agency. So you remember there's lots of discussion about 2 others. One particularly is called, people that refer to it as the Oxford or the AstraZeneca vaccine. It's 2 or 3 weeks behind in terms of process, the Pfizer one. There's an expectation that will be approved, and when it does, that's a much easier vaccine to handle and distribute. So it sits in a fridge, can be transported around, and there will be, when that hits the stalls, we'll be in a much stronger position to distribute it more widely and more quickly. So rapidly changing, watch out for it. We'll try and keep it as brief as possible. Patience with lack of clarity, because it's a challenging arena and plans might change. And the last thing on vaccines is just to thank everybody that's been involved in setting this up, whether it's yourselves or whether it's the people in your teams, to pass that on. And these are the people that often go sort of unrecognised, aren't they? So the transport, the porter in the facilities, the estates people, and the pharmacy, the technicians, a whole range, as well as the clinical staff, have been beavering away getting this up and running right across the county, and it's a pretty impressive setup. So thank you for that. I'm just looking on the chat. There's a question there about whether the vaccination is mandatory. So we said that it wasn't. My follow-up question is that if someone who opted out of the vaccine were to become COVID ill, any repercussions?
John, I've responded in the chat there. I've just responded.
Oh, good. We agree on that then. No, we don't. I think it's really important from a values perspective that we don't get into blame here and accusations and being heavy-handed from an organisational point of view. We'd like to be able to convince people that it's the right thing to do, from both a personal protective and a professional perspective. But there's a real emphasis that if people for whatever reason feel they don't want to have the vaccine, we're happy to have conversations. We're happy to point people to points of additional information, but we're just to keep reiterating it's not mandatory, and we won't be going through lists of people saying, "Oh, you didn't have the vaccine and now you've got COVID. This is what's going to happen." This is a pandemic, and it's had terrible impacts on so many individuals and families. It's about together finding a way through this, and the vaccine's a great opportunity for us to do that. So thanks for responding to that, Anne-Maria. So that's on vaccines. If there's any other questions, ping them in the chat. Just a couple of other things as we in terms of briefing, and then I'll take a pause. Just an update. We had update this morning at executive team on where we are with the lateral flow testing. Again, important part of the emerging infrastructure. We performed really strongly as an organisation. We've got 82% or thereabouts of our kits delivered from the delivery. We still think we're a little bit short to cover everybody, and we're obviously working with the regional and national teams to make sure that we've got sufficient to move around. We've had a really good uptake. We've had a very low number of invalid tests, and we've had a very low number of positives. I think out of 1,800 tests that have been uploaded, I think I'm right, there were 7 that were positive, and they were all confirmed by what's called the PCR test, which is the sort of the kite mark for clarity, and that rate equates to about 0.4, 0.5%, which is about where other organisations are that are putting the lateral flow testing out. It's not something that then results in, okay, I'm fine and don't need to worry about PPE, but it's a really good at clarifying an individual's COVID status, and that. I don't know, Anne-Maria, whether you might to follow up this up, but I just want to say a little bit about outbreaks, that we're still having them, and we do appreciate that there's still high rates of COVID across the county and around the East Midlands, and it would be impossible to be outbreak zero, I think, but it's really important that we continue to emphasise good practice around the use of PPE. And we know that it's difficult, it's challenging, hence we're in rooms to have that in our own rooms so we can take our masks off, and staff in clinical situations can't do that easily. But just to keep emphasising the importance of using that. Anne-Marie, do you want to say more?
Just a couple of things. I know how difficult it is to wear PPE for an 8-hour or a 12-hour shift. I haven't done it myself for many years. I know that that's difficult, but this is a plea, and the plea is to maintain adherence to the PPE guidance and also social distancing as and when you can. And the reason I say that is that we are still having several outbreaks, and we are one of the highest outbreaks in a mental health trust for the country. And we are higher, we have more outbreaks than NUH and Sherwood. So this is a plea to say that there's a level of responsibility as individuals to make sure that we're adhering as much as we possibly can. We are still seeing lots of people congregating in environments such as offices and other spaces, admin spaces, where people are letting their guard down a little bit and for longer than we would ask them to. You of course can take your mask off to take a drink and to take a break and to take sustenance. Absolutely you can, but we say that it's a maximum of 15 minutes, but it is still at a socially distanced space from your colleagues. So I just wanted to say that we are really high still. We are having regular COVID outbreaks in all our wards and also in other administrative spaces as well. The lateral flow testing is not a means to stop wearing. It's just another means to pick up whether or not we've got any asymptomatic staff. But it does mean that you still need to wear your PPE. It's really, really important to do that at this time, because this is protecting yourself, it's protecting our patients, and it's protected your loved ones at home. So it's just a real plea, please.
Thanks, Anne-Maria. And then just a couple of other things from me, then I'm going to hand back to Alex, who's going to coordinate the questions that have come in. The first one is still on vaccinations, about flu. So currently we're at 62%, and we're on track for what was our original timeline. You'll be aware from the last couple of weeks that in terms of where we are regionally and nationally compared to peers and other trusts, we're quite considerably behind. We were at the bottom of the regional league table. I'm pleased to say that we're no longer at the bottom, and we're not quite in red anymore. We're in dark amber. So there are organisations below us. So first of all, thank you for people that have continued to work in this particular arena and to help people get protected against the flu. But another plea to please continue to advertise it and offer it and enable your staff and yourselves to get protected against the flu. There continues to be a real big push, and again at Exec this morning we talked about how we could hopefully free up some peer vaccinators to help with that endeavour. It's really important if we can. So thank you for that in advance. There's a question there from Kumar. Progress to relation I'll come to that in a second, Kumar. So yeah, keep doing what you can with the flu, keep encouraging people to do it, and just to remind people that you need to make sure that there's a gap between having the flu jab and getting your COVID vaccination. I think, am I right in saying, Anne-Marie, that it's 7 days?
7 days, yeah.
And again, when we do start to vaccinate our staff, that'll be one of the check questions that you'll get asked before you get jabbed, to make sure that people are adhering to that. And then finally, by way of intro from me, just a couple of events to highlight, which are more celebratory. So we've got our Oscars session tomorrow afternoon. Really looking forward to hosting that with the chair, Paul Devlin. It seems such a long time ago. So this is an Oscars event to celebrate and recognise the great work that people and teams did during 2019. And we were planning to have, do you remember those times when we used to all meet and dress up and occasionally drink too much in March? But we postponed it a couple of times, but felt it was really important, given that the pandemic's playing out still, that to get this appreciation out there for those people and being nominated, being finalists and winning awards. It's on Teams, but that's the only way we can do it at the moment. But still, we're looking forward to a good session, and then energising a similar recognition for all the work that people have contributed to this year. So ordinarily, we'd be in the process of having judging panels and things in place almost as we speak, but again, we're a bit behind on this, but we haven't forgotten, and it's going to be one hell of a celebration, I'll tell you. And then the final thing to flag from me for now is the thank you event that's next week, which we're planning Tuesday afternoon to again recognise the fantastic feats of endurance, resilience, passion, commitment that everybody's put into what's been quite an extraordinary year. So that's that from me. Alice, I can go back to you then if you want to start to coordinate the Q&A piece.
Yeah, thanks, John. We've had some questions that have been sent in from colleagues, and just to share the first question. It's quite a long question, so it's I work in a community CAMS team north of the county. Managers have asked staff within the team to work extra shifts to complete assessments. We have had an influx of assessments and are at risk of breaching. We are also understaffed at present. Requests to work overtime have come from higher management. Several team members have agreed to work extra shifts. Not only are we committed to the trust, but also to support families and young people who need a CAMS service. However, we have all recently received an email stating that if we agree to work overtime in certain areas of the trust, we will be paid double time. These appear to be services within the south of the county. I would like to know why the decision has been made to offer staff of the same grade different pay rates, which goes against the principles of Agenda for Change, which is about equity of pay amongst staff, and how the decision was made to make some staff feel more valued than others. I can't speak for everyone, but this has made me and other colleagues I have spoken to feel totally devalued by senior managers. And I don't know if you want to respond to that, John.
Yeah, thank you, and thank you for the question. I think it's really important to be having conversations about this. So this was a tough decision, but it was based on a couple of things. One is it was based on some forecasting we've done on our ability to safely staff wards and crisis teams as we move into the next 8 weeks period of December and January, and that suggested that, as in previous years, we wouldn't get staffing levels to a safe level to cover these services, and hence we have made that offer for enhanced payments to cover additional shifts. So it was made on the grounds of safety. We do appreciate that it could be seen as being divisive, and that there are potentially other services who feel that they are in a similar position, and we talked as an executive team if that was the case for other services. If people still feel that is the case in terms of the safety of the provision of the service, we're happy to have a conversation about that. But that was the reason for the decision, and I again apologise if that wasn't communicated properly to people. Those shifts are open to all staff who are appropriate qualifications to work on the wards. It's not just for those ward staff. So that's my response to that, Alex.
Okay, thank you, John. We had a comment which I've picked up from Facebook, and I thought it might be good to address on here. It's a comment says, I read no tests were performed to check if there could be any changes in fertility of recipients linked to the COVID jab. This point is made on the leaflet for professionals giving the jab, yet missed off the leaflet for recipients. Wonder if the Trust could clarify, please.
Yeah, thank you. Again, that's a really good question. I know there's been quite a lot of conversation on our Facebook page about potential side effects, which is, again, it's great to be having these sorts of conversations because some of the answers just aren't there, whilst at the same time debunking some of the nonsense that's talked about vaccines in general. And you can tell I'm a very pro-vaccine sort of chap. I think they're important, and as I was talking earlier, but this is a really good point. So that there is one of the things to bear in mind that there are no long-term studies around particularly this Pfizer vaccine that's out there. They've satisfied the regulators in terms of the number of people that they've used in the pilots and in the studies, and there's a lot of data around immediate and medium term. They've only been in play for 6-9 months probably, and the science that underpins the Pfizer vaccine is its new vaccine technology, which isn't the case with the Oxford one that I referenced earlier. That's a virus platform, a delivery platform that's been in use so much longer. So the longer term side effects of that are more known. But within the studies that have been undertaken so far, there wasn't data looking at things that people have raised in the questions, such as around fertility and safety profile in women that are pregnant or breastfeeding. So the advice on for women that are pregnant or breastfeeding is not to have this vaccine. And again, I'm suspecting that the advice will be different for the different vaccines as they become recommended. So at the moment, we don't have a stance on it. It's we'll find as much information and for people, and so that they can make an informed choice. It's really important that individuals assure themselves or not that they feel able to take it. But there'll be a number of arenas of health conditions and comorbidities that won't be covered in the specific advice on the vaccine because there isn't any. It's not because it's been withheld, and that might be a bit vague, but that's where we are on at the moment. It's a bit frustrating position to be in because it'd be nicer to be a bit clearer on it.
Okay, thanks, John. We've just had a question through from Angela Walker, and I don't know if Anne-Maria wants to answer this. Will BME staff be seen as a priority group for the vaccine?
I mean, at the moment, we haven't had the full list. What we know is that everybody over 80 years of age that are currently within inpatient units, and we also know that we're looking at the care home staff and the care home residents and whether or not they can get to the two hubs. But at this moment in time, those are the two areas that we've been prioritised, including some of our frontline staff as well. In respect of BME specifically, we haven't got that down yet as a priority group at this moment, but I'm sure it will come. John might know more about that.
Well, the only thing I'd add, Anne-Marie, is that I think that will be informed by the COVID risk assessments that everybody did, probably longer ago than it seems, but a few months ago. So we've got all that logged in terms of. Do you remember that? That there was a risk assessment, and you could approximate a COVID age, couldn't you? And certain groups of people scored more years. So I think that will put a number of people from the BMA background in a higher priority group. But again, that's a really good question, Angela, and that'll be something in the it's being worked out category at the moment. So I think the likely answer is that some will, yes, but if you could bear with us while we work that through.
Okay. Thanks very much. We've had another question, which was following the publishing on the 1st of December by the HIV Commission final report and recommendations, how England will end new cases of HIV. I'm interested in how this trust is working towards or planning to engage with these recommendations, for example, helping towards 85% reduction in new HIV transmissions by 2025 by introducing a standard blood test for HIV to patients as part of their healthcare and treatment. The recommendation was that it would become an opt-out intervention. Just wondering if somebody would like to answer that.
We have spoken to the medical director, so we do know. So it was only, like you say, it was only published early December of this year. So the medical director is reviewing it at the moment, and we will be able to come back with the recommendations for the organisation. And we don't have any specifics at the moment, but individuals with a particular interest, please feel free to contact us because we'd like to engage with you in that as well. But we don't have any definitive answer at the moment. We're still reviewing the document.
Okay, thank you ever so much. Just a couple more questions. Just from a personal point of view, how are you looking after your own personal well-being at this time?
Drinking heavily, lying in a dark room for 8 hours a day. Oh, I'm not allowed to say that, am I?
No, I'm not allowed to say that.
Maintaining a sense of humour and perspective, I think, is really important. As I say on these sorts of things, I'm really lucky that I can relatively switch off, whether it's losing myself, listening to music or reading a paper or exciting things like that. I exercise regularly, particularly at weekends, go on long runs, and that clears my head. But I think trying to maintain that sense of perspective and balance is really important. You know, so these are really trying times, aren't they? And they're big things that we're talking about, and, you know, mass vaccination for 60 million people is no mean feat. But at the same time, it's the small things that of looking after yourself and your family and your loved ones are critically important too, and finding time to do that is important. There's no getting away from the fact that it's tough, isn't it? And I appreciate that, you know, people are working so hard at covering this off. And it is, I thought it was just fantastic watching the news yesterday. But really, not that I never feel not proud, but really proud of being part of the NHS. Just a fantastic place to be, and it really showed its true colours yesterday. And that's me, Anne-Maria. Never touches a drop.
Never touch a drop. I'm equally. I feel very lucky. I'm similar to John. I'm quite good at being able to switch off. Over the years, I've learned how to do that. Back in 1996, I had a real bad period of feeling anxiety and stress. There was a lot coming at me. I was doing my masters. I was a ward manager, and it was all coming at me. And I remember it vividly and how it felt. And I learned how to put things into place following that episode. And I've never let it happen again, because I feel it. I know what it feels like when it comes on. See it in others as well. I'm quite good at identifying in others if they're feeling stressed or anxious, or they're not coping at that moment in time. So I'm really good at putting things into place. I've had a new bath built. I take lots of lovely baths. I also do boot camp. I'm similar to John. I've really enjoyed doing boot camp. I started back up again yesterday for the first time in 9 weeks, so I'm struggling to walk around today. And I've started baking. I never ever baked before. I'm not a brilliant cook, no chef or anything like that. So I started baking and I've thoroughly enjoyed it. So I have lots of things really. I'm a grandma, so I've got 2 fabulous grandchildren that I enjoy. So I feel lucky because I know what that feels like. That, you know, where I've been there and I don't want to be there again. So I know what to do and what to put into place.
Thank you. Alison.
Hi, I think I've got a mixture of what John's going through does and what Anne-Maria does as well. So from my personal point of view, it's about making sure you've got that work-life balance. I struggle at this time of year generally with the dark, short days. So for me, it's about making sure I get plenty of fresh air. I've got a new puppy, so lots of dog walking, and I try to get as much daylight as I possibly can. So now we are working from home. I do actually try and get out for a dog walk at lunch when my diary allows. I've got a new Garmin watch, so I join every week now. I join the 100k steps challenge, competing against people I absolutely don't know, but the competitive streak in me makes me do it, and I've won for the last 2 weeks, so that's a result for me. I do understand where Anne-Maria's coming from, because I had a personal, a bit of a crisis about 3 or 4 years ago when everything got on top of me. So for me, it's really important that I keep up these things in terms of exercise and the perspective that everybody's talking. I think the other thing, and joking apart, most people who know me do know I like a glass of wine, but for me it's about limiting the wine at the moment, because it's important that my mental health is in the right place for what we're doing at the moment, because it is a very challenging time. But there is a balance, and Friday and Saturday night the wine is poured, but just not any other time. But no, that's generally how I cope with it. And looking forward to having my children back over the Christmas period, which will be really nice. It's been a very quiet lockdown for me this time, which has been a big change to the summer. So that's me.
Oh, that's great. Thank you ever so much for sharing. Just in the chat, we've had some comments through from Mark Howells just with regards to pregnancy. So thank you ever so much for sharing that, Mark. And also a question regarding an organisational chart, and that's been updated and put in the chat from Suzanne Aitken. So that's fantastic. Thank you ever so much. Just one more question that had been sent in. What are your top priorities for 2021 as a executive leadership team, if you've had chance to plan anything here?
Yeah, to survive 2020, 2021, well, there's a whole load of things, isn't it? And I would like, from an organisational perspective, for Notts Healthcare to really start to be recognised as one of the top mental health learning disability community trusts in the country. So I think we've got the expertise, we've got the experience to really knock it out of the park. And we're a huge organisation. We're really diverse, and people will know that. In my view, is that we've been a bit under the weather, shall I say? But I get a real sense that things are really starting to move forward, and that's due to people on this call and colleagues, really hard work and endeavour. I'd really like to so if I can sort of talk as it's accepted that as we start to move through and end the pandemic, I think that will take quite a lot of 2021, but towards the end of the calendar year, to refocus on the culture and values work, I think that's key to a really strong foundation. We've made some good progress on it. I still think there's a lot to do in terms of giving people the confidence around their competencies, around enabling them to develop and offering them support to do that either individually or within teams is a really important part of what this organisation can do. So a sort of refocus on that foundation piece, we get that right, other things will fall into place. I think there will be a real refocusing on this move from organisational sovereignty to system working, and what does that mean? And it's an easy thing to say. It means lots of different things to different people, but to start to feel confident about what our contribution to that is. So, for example, we've got lots of our people and lots of our teams work across different organisational boundaries, and the way the NHS and social care is set up, that makes it really difficult. So our patients flow, don't they, through different primary care, community care, acute care, our care boundaries. And when a system is working well and collaboratively, those boundaries will be much more easy to navigate. And I think that's a massive part of what we need to describe and work through for 2021. I could go on, but there are a couple of things for me. Alison and Maria.
Do you want to go, Alison?
Yeah, I can do. I was on mute. I started talking on mute first time today. I think for me, it's about for the first time since I've been doing this job and since I've been in this trust, we're heading for a financial deficit. So for me, my absolute priority for myself and the teams and the rest of the trust is about trying to make it a sustainable financial future for us all. So about doing the best we can in terms of governance of expenditure and trying to get as much income in as possible for what we're doing for our patients and staff. So that's my biggest priority. So we have a plan next year that is achievable and affordable, so that the clinical services can do what they need to do, and that's about looking after our patients in a safe way. So that's me. I'll pass on to Anne-Maria.
So mine is very similar to what it always is, and that's in respect of getting a better inspection report from CQC. I can see John smiling at me there. I feel that that's a really important area because it shines a light on us. It gives us an opportunity to celebrate the good. And it also gives staff the opportunity to be able to say, do you know what, we deliver really great services for our patients and our carers. And I love the fact that we can do that. And often external view of us gives us that little bit of a tick in the box that says, do you know what, that's a really good trust over there. You can really ensure that whoever goes in there gets really good care. And I think that's so important for us to be able to say that to ourselves, but also say that to the outside world as well. And the outside world know it. We are really good at some of the things we do. We're just not great at selling it and telling people. So I feel that my job and my priority next year is to help you, all of you, to tell people the fabulous work that you do. And that is through things like, getting us ready and preparing us for what that looks like. Inspections are never easy, and people are often really worried about them because they think it exposes them. But actually, you need to see it as an opportunity to say, do you know what, I'm going to show you all the fabulous things we do. So that's my priority next year. I'm here to support staff to get there, to understand what that means, to understand what it looks like, not to be afraid of it, but to see it as an opportunity. But what comes with that preparatory work is things like the Book of Excellence. Look what you're doing. You're putting together fabulous things to say, look at this brilliant piece of work we've done. So what comes with preparatory work is other things that fall out of it. Like, I've just included an A3 poster there. And yes, we've done that a little bit because we know we're going to be inspected, but actually that's a great thing for us to have out anyway. And also being able to pull together some really great things on the website, put ourselves forward for awards, start to tell people out there to use case studies that we've done, because actually some of the great things we are doing is important, but others can learn from it as well. So that's my big thing next year, is to really support staff, the whole trust, to get us into a place where people can really say, we're spot on, we can do this, we're great.
Oh, thank you very much.
That is one of Anne-Maria's objectives, isn't it, Anne-Maria?
It is an objective, as well as sort out the flu.
Just to add, I'm 100% with Anne-Maria on what she just said, but we have got, and the CQC aren't inspecting in their traditional way at the moment because of the pandemic. But we do know when they have been coming in to do sort of mini inspections based on risk and concerns. We've had some really good feedback, and whilst we'd never be complacent, we know that there's some areas in each of the divisions, well, particularly in mental health and disability wards and at Rampton Hospital. They may say it's been light touch, but those reviews were very detailed, and they gave us some really positive feedback on how staff have really engaged in the response. And I know also in the community division, in terms of the preparatory work that teams have been looking at, because quite a number of those services haven't been looked at by the CQC for a number of years, it's really strong. There are two key things to add about the CQC that impacts on how an organisation does it. The first is your relationship with their lead inspectors, and we put a lot of work into making sure that we've got a really strong professional relationship with them, and we're open and transparent about what our concerns and issues are. Because the second thing that is really important is they know that things don't always go right and that things happen. That's not the issue, it's what you do about it. So it's how you respond. So, if there's a never event, or there should never be, but there are occasionally, if there are issues, it's how you respond. And importantly, it's when you receive the report, it's not, it's CQC having a go again. It's how you respond to that feedback. And I think we're in a much improved position on how we've responded to their commentary on some of our issues. So it's a huge piece of work. I know lots of people are involved in it, but feeling positive that we're engaged and we're on the right track on that. Sorry to go on about that, but you are right, it's an important domain.
Thanks, John. Is there anything else before we draw it to a close? No?
There was I don't think we've responded to Kumar's thing about a question about accessing vaccines for people that are working in the Leicester patch. I can't answer that specifically at the moment, Kumar, but we'll get back to you as to whether as to what the arrangement will be. And I think we may well be instructed rather than being able to decide ourselves, but we'll let you know as soon as we can.
I will just mention something. Kumar might not know this. I don't know where Kumar lives. So I live in Leicestershire, and interestingly enough, it was on the local news. They're in uproar because they've not been given one of the big hubs like all the other counties have been given, particularly on the back of Leicester being one of the big outbreak areas in wave 1 and beginning of wave 2. So they are kicking off quite a lot about the fact that they don't seem to have prioritised Leicester. So that does impact on us a little bit, Kumar, in respect of what we're able to do. So it's just watch this space a minute, because at the moment it's very political within Leicester.
Thank you very much. Thank you all for sharing, and as Catherine has said, thank you very much for your honesty with regards to the question on wellbeing. We've got another session next week, so thank you all very much. Thank you.
Thanks, everybody.
Thank you.
Thanks for your questions. Bye.
Bye.